Of allocations, the education sector is the biggest beneficiary of Kenya Kwanza's inaugural budget with an allocation of over 600 billion shillings, actually 630 billion shillings. This being 80 billion shillings more compared to what was allocated by the Jubilee administration in the financial year 2022-23, which ends on June 30th. The health sector, however, will receive 5 billion shillings less. Martin Mwangi breaks this down for us.
National Treasury Cabinet Secretary Professor Njuguna Ndung'u has proposed an allocation of 628.6 billion shillings to the education sector, an increase of 84.6 billion from 544 billion shillings in the 2022-2023's budget. Out of that, 12 billion shillings will cater for the free primary education, 65.4 billion shillings to the free secondary education, which includes NHIF. Junior secondary schools which are faced with challenges of insufficient infrastructure in classrooms and laboratories will receive 25.5 billion shillings. The Teacher Service Commission will receive an increased allocation of 316.7 billion shillings from 300.1 billion shillings in the previous year. University students and staff will, however, have to put up with a reduced budget of 97.5 billion shillings from 108 billion in 2022-2023. There will, however, be more available to the learners in form of loans, as the Higher Education Loans Board (HELB) has its share doubled from 15.8 billion shillings to 30.3 billion. The CS says that the government will continue to address the inequalities in the education sector.
We have redesigned the competence-based education curriculum to make it responsive to our education needs. And fourth, I've employed over 30,000 teachers in a historic and unprecedented drive to improve the national teacher-pupil ratio and enhance performance.
The health sector will receive 5 billion shillings less from 146.8 billion shillings in the 2022-2023 financial year to 141.2 billion in the current proposed budget. This represents 3.8% of the total budget. This means that we are still short of the Abuja Declaration made 22 years ago, which requires African Union member states to prioritize the sector by allocating it at least 15% of their budget. Universal health coverage has been allocated 18.4 billion shillings. 24 billion shillings has been allocated to the fight against malaria, tuberculosis, and HIV/AIDS under the Global Fund.
Towards this end, Mr. Speaker, I propose to the National Assembly to effect budget allocation of Kenya shillings 141.2 billion to the health sector to support various programs aimed at supporting universal health care coverage.
4.6 billion shillings has been allocated to vaccines and immunization, while 4.9 billion shillings will go to the health research and innovations. Martin Mwangi, NTV.
Right, it's time for another break, but still ahead.
Whoever wants to talk about this issue, that Babu ran away or what, that is your cup of tea.